Hi, my name is Jasmine Shawell-Wallace, and today I'm going to be sharing with you all my presentation on my management practicum for this semester. To give you all the introduction of everything I'm going to be talking with you all today, I'm going to give you some background information on the facility that I work in. I'm going to give you some information about the preceptor that I work with this semester. I'm going to talk about the overall practicum project, some of the smaller projects that I did, and the larger projects that I did. I'm going to give you all a description of each thing that I worked on. Excuse me, to give you a little background information on the importance of some of these different tasks I was given. I'm going to give you some information on the Lean Daily Management Initiative, which is what was my big project for this semester. I'm going to talk about some of the project management things that I had to learn, some issues that I had, and I'm also going to talk to you about some of the lessons that I've learned this semester in practicum from my chief nurse and from my experiences working on different leadership and management tasks in the medical group. I am currently working at the 374th Medical Group in Yokota Air Base, Japan, which is currently located, in the Tokyo Prefecture. We have on average approximately 200 newborn deliveries a year and about 700 surgical cases annually. The inpatient unit has 15 beds and they receive labor and delivery, newborn, pediatric, medical, surgical, and psychiatric patients. There are also several other smaller clinics ranging from occupational health, internal medicine, family medicine, and pediatrics within our facility. The overall vision of the 374th Medical Group is to provide the best medical care in the Pacific. The mission of the 374th Medical Group is to provide professional health care every time, frontline medics anytime. And you see that I have a picture here. This is what the front of our medical group looks like. So this semester for my practicum, I got the really great and amazing opportunity to work with our chief nurse. Her name is Colonel Tanya Dawson, and she's the chief nurse executive within the 374th Medical Group. She has a very diverse background with experience in program management and nursing leadership. She has had experience as a deputy squadron commander, chief nurse, flight commander, nurse manager, and clinical nurse. She is a med-surg nurse by trade, and she has extensive experience in that area. She is a board certified RN, and she has 26 years total of nursing and military experience. She has 2 advanced degrees, one a master's in business administration and a master's of science in nursing and information systems. She has extensive knowledge and education within patient safety, quality assurance, and she was also a patient safety fellow last year before she started this assignment here. Colonel Dawson, as the chief nurse, is responsible for all the Air Force, all aspects of nursing care and practice of nursing and medical technicians within the facility. This job is typically filled with a nurse that has at least a master's degree as far as education, and typically is filled by a 05 to 06, so a lieutenant colonel to a colonel, or it can be a major with a line number for lieutenant colonel. These positions are given to nurses with lots of experience in leadership and management, as well as strong background in nursing. She has several different responsibilities within the medical group. She's responsible for the education and training of all the nursing staff and medical technicians. She is responsible for mentoring all the nurses within the medical group, providing career counseling, initiating and patient quality control, as well as following up with patient safety reports. For my practicum project this semester, I got to work on multiple different projects. Some of them were small projects, and then I had one really big project that was the key focus of this semester. The chief nurse currently sits as the chairman of the Nurse Executive Meeting Council, and at this meeting, they review patient safety reports, uh, review education and training stats for the personnel, nursing personnel, medical technicians, as far as making sure everyone has the current and correct life support skills, competency trainings, uh, opportunities to go out and do other trainings in nursing, and making sure that all the nurses are completing at least 16 continuing education units per year. The Nurse Executive Meeting Council also is a forum where they review peer review charts, do chart audits, and review patient safety reports in order to figure out ways to improve processes and ways to resolve patient safety issues. I also got the opportunity to create and generate a career counseling and mentoring database for my chief nurse. This was a tool that can be used by her and any other incoming chief nurse to know the names of all the nurses, where they're working, when they've had career counseling, when they've had their certifications, their goals, and some of the things that they need to be doing in order to make sure that they're hitting the correct milestones to ensure promotion. With this database, the chief nurse can go in at any time and pull up the spreadsheet and at a look's glance know who she needs to meet with, know who she hasn't met with, and know who she needs to review and submit for assignment preferences and considerations. I also got the opportunity to revise and work with her on some group operating instructions, which was really great exposure for me because it helped me familiarize myself with the documents as well as some of the civilian guidelines from American Nursing Associations and telehealth programs that we help mold our actual instructions around. I got to review the operating instructions for our telehealth program, our nursing services program, our patient transfer program for patients that need to be transferred off base to Japanese facilities. And I also got to review the bloodborne product administration program. This was all a really great learning experience for me. She also gave me some experience with working with marketing. I got the opportunity to revise many job requisition statements for different nursing positions in different fields, ranging from labor and delivery, medical surgical, same-day surgery, emergency room, pediatrics, healthcare integrator, and nurse manager positions. This was a really good opportunity for me because it gave me the chance to learn the requirements and the expectations of different jobs and different fields in nursing, the type of people that we're trying to recruit and look for in order to fill those positions, and how to utilize marketing effectively to attract good quality nurses into your facility. This specific initiative was very important to us because we have issues with manning. We are currently at a location where a lot of nurses do not want to come because we're at a remote location with limited resources. And so this gave me the opportunity to be really creative and rewrite the job statements that we post on our Air Force assignments availability webpage to find ways to kind of draw in different talent and things of that nature. And as a result of the new job statements that I posted, we were able to get 6 nurses to volunteer to come over to our facility, which is a much better situation as opposed to most of the nurses that we have now. Approximately 85 to 90% were voluntold to come to our location and didn't necessarily want to be here or come here. And then lastly, the really, really big process improvement initiative that we implemented was the Lean Daily Management Program. So the reason why Colonel Dawson and myself decided to implement the Lean Daily Management Program is because there currently is no official process improvement or quality improvement program in place within our facility. There are some process improvement initiatives that are taking place within the organization, but there's no oversight. There's no way to track them. We have no idea of what process improvement programs are in place, what have already been done before, what have been completed, and it just gives a situation to where we don't know what's going on within our organization, and it can cause many people to be reinventing the wheel and doing things that have already been worked on. In addition to this, um, we are always constantly working to make sure that we are meeting the Joint Commission standards and measures. We are very constantly tracking our measures and orgs, which are some of the uh, criteria that the Joint Commission uses to make sure that we are delivering quality care. And having a process improvement program in place can help us effectively make sure that we're meeting those measures and that we're able to maintain our accreditation in the future. So just to give a brief description of what the Lean Daily Management Program is, it is a process improvement program that is very unique because it incorporates leadership along with frontline employers to put in place new initiatives. It requires active participation at all levels of leadership, and it provides a great opportunity for leadership to be involved, know what's going on in our organizations, provide the support that is needed, as well as insight. And it gives frontline workers and staff members the opportunity to identify things that they see in their duty section that they're working in every day and um, help implement this program and make things better. The whole purpose of the Lean Daily Management Program is to enhance our patients' experience by identifying the effects our processes have on our population. It is a leadership robust process for improvement and the improvement of the safety culture within an organization. So the primary thinking or the thought process of the Lean Daily Management Program is that typically you're in your duty section and you say you perceive that something does not right, this process does not seem right, or there should be a better way that we can do this process. And so you brainstorm and you consider, okay, is this really a problem in comparison with reality? Then you think about what are some of the factors that are causing the problem. What are the most significant factors? And then you go to the next step, which are interventions. What can we do that can help intervene and eliminate this problem? And how we eliminate this problem? Are there any additional factors that we need to address that we uncovered while implementing new interventions? And then you repeat as needed. What goals should we focus on next? So it's a continuous quality improvement program that you track and work on daily. Excuse me. The project outcome of this Lean Daily Management is that we put 3 continuous quality initiatives in place, and they were focused on improving our ORIX measures and quality of care. They were addressing tobacco use, alcohol use, and breastfeeding education within our unit. The most important thing within this whole Lean Daily Management Program is to have executive leadership buy-in. Because the reason why this is so important is because you need your executive leadership team to do the daily rounds with you at your Lean Daily Management Board to know what you're doing, what's going on, and it's a commitment that they have to be able to do. You also need to have staff member buy-in. There's going to be different staff members that are going to be working with this. It's not just one person, and at any time, any staff member should be able to brief what's going on your process improvement board to the executive staff. And in order to have continue this effort, you need staff member buy-in, especially on units where you're shift workers, where you have different nurses and different teams working on different shifts. The daily rounds and rotations were typically 3 minutes long. The executive staff comes in, you tell them the question that you're trying to answer, your goal, the occurrences, some of the interventions that you have in place, and what you're doing to work towards solving the problem. The overall goal or project outcome of this Lean Daily Management issue is to increase our ORIX measures and compliance for the Joint Commission standards. So there were several different management strategies that were utilized to implement this final project. And the primary text that I used throughout this process is the text by Harris, Rossell, Thomas, and Dearman, The Project Planning and Management, a Guide for Nurses and a Professional Team. This book was very instrumental and was like my Bible during this process because it told me what I needed to do step by step as far as selecting a program, having a reason, building a team, working effectively in that team, measuring your outcomes, and communicating effectively with each other. Excuse me. So having this text and using these different strategies helped increase staff and leadership support because we were able to coordinate